Good afternoon, everybody, and thank you for joining our webinar today. This is the third webinar that the Asia Pacific Observatory on Health Systems and Policies is running this year. And this particular webinar is focusing on aging in the Pacific. I'm going to put a few slides up to begin with, and then I'll do some introductions. Just to let you know that during the webinar, we'll be adhering to WHO Code of Conduct to prevent harassment, including sexual harassment at WHO events. For the webinar itself, today's webinar is around aging in the Pacific. And we have got a very strong team representing multiple institutions who are working on this issue. And the reason that we want to talk about this is that as any other part of the world, we're seeing that there is an increase percentage of the elderly population in the Pacific Island. And that has got its own connotation and its own consequences. We are seeing a movement away from an episodic integration with the healthcare to a much more integrated and person-centered support for the elderly population. And that means that we need to actually look at a much more integrated system. Because of those demands, the APO, the Asia Pacific Observatory on Health Systems and Policy, we commissioned and produced a policy brief around strengthening the health system response to an aging population, specifically for the Pacific Island countries. And try to identify policy gaps and actionable strategies to move and fill those system issues. We have Anna Palagyi here, who is the main speaker, and she was the editor of the actual book, the policy brief. Anna is currently an associate professor at the University of New South Wales in Sydney, but she's also the program lead for the aging program in the George Institute there. Anna is supported and followed by three panelists that are going to talk about different angles. We have Dr. Ling Perman, who is the head of the School of Medical Sciences in the Fiji National University. She's had many leadership roles, including being the president of the Internal Medicine Organization of the Pacific. And she's also a member of the World Gastroenterology Organization Climate Change Working Group. Then we also have Dr. Ilisapeci Kubuabola, who is the team lead for NCD's Prevention and Control Program at the SPC, the Pacific Community. Dr. Ilisapeci is a Fijian public health physician and epidemiologist, which has had over 20 years of experience in communicable and non-communicable disease prevention, surveillance, and policy across the Pacific Islands. As I said, she's now working for the SPC, providing strategic leadership and technical assistance to the 21 countries and territories there. Focusing on different areas, the Pacific Monitoring Alliance for NCD Actions and the Pacific ECHO, a regional knowledge sharing platform with WHO and FNU. And then finally, we have Dr. Michiko Kanda. Dr. Kanda is a technical lead for the Healthy Aging Unit within WHO Western Pacific Regional Office. She's been in that role since March 2023. And prior to that, she has been working on at the country level for the UNAIDS program in Myanmar. And prior to that, she was also working as the lead person looking at nursing services in the WHO Southeast Asia Regional Office. That's the introduction. Before we move, I'm going to give you a little bit about APO, just for those who don't know. The Asia Pacific Observatory on Health Systems and Policies is a partnership which is hosted by WHO, focusing on the health policy systems research in the sense of knowledge generation, managing, and brokering it. We are a partnership with different countries, as well as both WHO Zero and WHO Wipro and the Pacific community. Our vision is trying to change the and produce a culture of evidence-informed decision-making across the both regions, be it at national or subnational level. We do this by knowledge generations, and this is part of that, the actual policy brief that was produced, but also knowledge management and brokering, which includes different aspects of policy dialogues, webinars, and also trying to work with policymakers in translating what the evidence produced. We have 5 broad thematic areas that we're going to be focusing on for the next 5 years. These are primary healthcare, or UHC, the digital health, human resource for health, health equity, and health system resilience to climate change and pandemics. But in addition to that, we have a number of cross-connect activities, which includes the health system reviews of the countries, webinars, meeting with policymakers, and specific HPSR events. Our publication, as I mentioned, includes health system reviews, includes policy briefs and comparative country studies, and we also support publication of our findings within different journal articles. We do most of our work through a consortia. Consortia is a grouping of academic institutions across Asia Pacific who work on those 5 thematic areas to try and to actually generate the evidence and then support in capacity building in the countries and moving the generated evidence into the policy sphere. We actually have a very broad reach in the region. Our consortia, there are 15 of them. They cover 19 countries, and there are more than 50 actual institutions in these 19 countries that we work on those cross-cutting areas, on those thematic areas, as well as cross-cutting areas. With that, I want to say thank you. I am now going to ask if Anna, if you want to start to talk a little bit about the policy brief. After Anna's presentation, we will then move towards a panel discussions, and we'll be looking forward to Q&As from the participants and the registrants to build more around how we should actually move this particular issue forward. Over to you, Anna.
Thank you, Nima, and thanks everyone for joining today. It's really my pleasure to be able to present the work that's underpinned this policy brief and talk a little bit about the recommendations. I did just want to start by acknowledging the traditional custodians of the lands from which we're all joining this webinar today. For me, in sunny central Sydney, it's the Gadigal people of the Eora Nation, and just to pay my respects to elders past and present. So today we'll be talking about the policy brief, Strengthening the Health System Response to Population Ageing in Pacific Island Countries. I'd really love to acknowledge the co-authors on this brief, Dr. Selena Motafunga and Dr. Amarita Ravuvu from the Pacific Community, Dr. Ling Perman from Fiji National University, who's joining our panel today, and Dr. Adam Craig from University of Queensland. And just to very much thank and acknowledge the Asia Pacific Observatory on Health Systems and Policies for the support in producing this brief. Also to importantly acknowledge project partners, and you'll hear in a minute about the setting for the research underpinning this work, but we worked closely with the Fiji Ministry of Health and Medical Services, the Department of Health and Social Affairs in the Federated States of Micronesia, as well as the Ministry of Health in the Kingdom of Tonga. So a huge thanks to the partners in each of those settings, as well as the research teams who had the very important role of gathering the evidence underpinning this work. So in approaching the formulation of this policy brief, we really had 2 key aims: to inform priorities for developing older person-centred and integrated healthcare services across the Pacific Island region, and to look at the policy question of how can Pacific Island country health systems really be effectively strengthened to achieve universal health coverage for older populations. In doing this, we had a couple of expected outcomes. One was to produce some evidence-based guidance for national healthy ageing policy strategy and services, particularly for the 4 settings in which our research component took place. And then secondly, to produce this regional policy brief to present that evidence to support recommendations on healthy ageing policy and intervention priorities for Pacific Island health decision makers to really consider. So we used a 3-component methodology to gather the evidence behind this policy brief, and our data was collected from all the way back in June 2019 through to April last year. The primary research component, as I mentioned, was conducted in 4 country settings: in Tonga, in Fiji, in FSM, and in Vanuatu. And we pulled together each of the findings from these 4 countries to really compare and identify common, contrasting, and complementary themes. The 3 components of the work included, firstly, taking publicly available, accessible data to generate a snapshot of ageing and health. Some of this data included administrative data from health systems, from national survey reports, data produced by the Global Burden of Diseases study, for example, was very important in this. But we pulled this together to just try and collate a pretty clear picture of some of the key health and social care issues being faced by older populations in the region. The second component, we looked at mapping healthy ageing policies, strategies, and plans throughout each of the 4 countries, just to get a picture and overview of how countries are currently addressing population ageing through their policy environment. And we mapped these policies to the World Health Organization's regional action plan on healthy ageing in the Western Pacific, and the 5 objectives of that action plan, which I'll talk to briefly in a minute. And the third, and I think the most important component of this work, was to evaluate user perspectives on priority health system responses to ageing. And when I say user, I mean older adults themselves, caregivers and families, as well as those providing services, healthcare workers, government and non-government services targeted to older populations, and policymakers themselves. We really wanted to evaluate the acceptability of current health system responses, as well as, what needs to happen in the future, and, what particularly older people and caregivers want and need to be able to age healthily. So this is the analytical framework I mentioned previously. You may be aware this is the Regional Action Plan on Healthy Ageing in the Western Pacific, published in 2020, and it really underpins the UN Decade of Healthy Ageing, which runs through to 2030. And we use those 5 objectives there to map out ageing policy environment in particular, just to identify where the strengths exist and where some of the gaps. So some background to ageing or population ageing globally first, and then we'll hone in on the Pacific. So we're probably mostly all aware that back in 2015 through to 2050, the proportion of the world's population over 60 years of age will nearly double from 12% to 22%. You can see there that trajectory is rising rapidly through to 2050 and then beyond. We can also see that the trajectory for the older age group, those 60 years and over, is increasing at a much, much faster rate compared to the population age groups of a lower age. And we've seen just a few years ago is the first time in the history of the world where the population over 65 was a higher number than the population under the age of 5 years. So why is this happening? We've got declining fertility rates. We know that advances in public health, in medicine, mean that people are living longer, and that's fantastic. We've seen women are living longer than men, but the real question that remains is that are the later years in life now spent in good health? And there's actually no clear evidence that older people today are living out their later years in life in any better health state than those in generations before them. So ageing in the Pacific, we're actually going to see that by 2050, some of the populations aged 60 years and above will almost treble. With that increasing growth, we're seeing an increase in non-communicable diseases, multi-morbidity, so having multiple chronic conditions at the one time, and then disability that's linked to age-related declines in mobility, in sensory function, and in cognitive function. We know that the majority of older persons in the Pacific, like elsewhere, are going to be women. And in fact, 60% of the oldest old, and that's a term that's used to coin those who are 85 years and above, will be women. And we also know that in the Pacific, the health systems have been historically geared towards a young population, and they remain challenged by the management of chronic conditions, by aspects of integration and supporting continuity of care, and it also largely lack a coordinated approach to palliative or end-of-life care. Because very little to date has been done on this issue of population ageing in Pacific Island countries, governments in the region are really hindered by a lack of knowledge of what is needed and what works for the care of older persons in their context. So here's just a few figures from the UNFPA that shows the growth of the ageing population in Pacific Island countries. It's occurring in different rates throughout the region, most rapidly in small countries of Polynesia and Micronesia, and much more slowly in Melanesia, with the exception of Fiji, which is one of the most populous Pacific Island countries. In terms of numbers, you might look at that and think, well, that's a small number if you're coming from some of the more populous countries, for example, here in Australia. But even these numbers in already stretched health systems and small populations are going to have a significant impact, not only on the delivery of care, but the ability of people to access the care that they need and be able to really achieve the quality of life that they deserve as they become older. One of the other important statistics, I guess, to note is the concept of the potential support ratio. And that's the number of persons who are really potentially economically active in that age range of 15 to 64 years, who are available to essentially care for people aged 65 years and above. And that lower the support ratio, the fewer people there are, and that really places an economic stress on families and on countries themselves. And you can see across all of the Pacific countries that potential support ratio is dropping over the next decade and on to 2050. What does that mean for health systems, though? So we've seen the changing health profile. There's an increasing prevalence of non-communicable diseases, multi-morbidity, disability. These together create an increased demand for health services. And in addition, it's more expensive health services. So we know that lifelong treatment for chronic diseases is much more expensive than some of the treatment for communicable diseases. Other aspects to consider within the health system are around human resources for health, service delivery models for an ageing population, aspects of social protection, burden on households, whether that be financial or other, and also the concept of multidimensional poverty. So we know that older people in rural communities, for example, are more likely to suffer hardship than their urban counterparts. We also know that women within those groups are disproportionately affected. So I'd like to just quickly run through what we found in creating this policy brief. And in 3 sections, the first is that ageing and health snapshot, looking at the policy environment in the second section, and then thirdly, the user perspectives. So here's some key statistics that we pulled together, and you'll find them in the policy brief themselves. We present these for each of the 4 countries that was involved in this policy brief. You can see that the proportion of the total population aged 60 years and above is still relatively small, but this will increase over the coming decades. A few things to highlight here. In Fiji in particular here, this concept of the healthy life expectancy at birth. So this is the number of years that people can expect to live in good health. Despite have a life expectancy of up to 67 years, the healthy life expectancy there is 58.7 years for women and 56.7 for men. You'll also note in Tonga there the increasing or the greater proportion of older people living in rural areas, and we see this throughout the region. Rurality is quite hard to define in the Pacific, but basically any of those areas outside the urban city, often just the capital city of the country, as well as some of the maritime and island communities. Similarly, in Vanuatu and FSM, small proportion currently of the population aged 65 years and above, but again, high proportion living in rural areas, healthy life expectancy quite young, 59 years in FSM. And in Vanuatu, to note in particular, that age dependency ratio I spoke of earlier is very high in this case, which again means that there's a much higher proportion of older people who are reliant on those who are currently economically active. In terms of morbidity and mortality, unsurprisingly, again, chronic disease, non-communicable disease is the greatest cause of death and disability among the older age groups throughout the region. Cardiovascular diseases remains a leading cause of death, type 2 diabetes as well, and, you know, responsible for almost up to 80% in some countries of deaths. We looked briefly at current social protection and long-term care models. Across each of the countries, these consisted of most strongly informal arrangements, which focus on extended families and kin. Contributory retirement schemes, so these were for formal sector workers only, and also non-contributory social security schemes or old age pensions, which are present in Tonga, Fiji, and Federated States of Micronesia. There's also cash transfer programs and food security programs in a couple of the countries, as well as a disability pension in Micronesia for those who are insured. Tonga provides one of the only examples of a national home care program, which is run by a non-government organisation with support from the government, and they provide home care services to a limited number of older persons. So the extended family is really traditionally the support network for frail older persons, but also for dependent children. And we saw through our work this increasing reliance on intergenerational care. So a lot of grandparents caring for their grandchildren at home, while the grandparents' children themselves are off elsewhere for employment or education. And we also saw that there has been an erosion of some of these traditional social protection structures, and this has largely been precipitated by outmigration, so people leaving their communities either to the capital city of the country for education and work, or internationally for education and work, leaving behind the families. And this really heightens that need for formalised social protection strategies and long-term care initiatives. The second component of our work, we were looking at the policy environment across each of the 4 countries, specifically in relation to healthy ageing. We reviewed 66 policy documents across the 4 countries and found that most of the objectives set out by that WHO Regional Action Plan on Healthy Ageing were only partially reflected by policy or strategy. And there's an example there of how this is presented in the policy brief itself, how we've sort of mapped out where nations were addressing these objectives through that policy environment. None of the 4 countries had current comprehensive national ageing policy frameworks, but every country did have at least one overarching policy document that explicitly mentioned older adults. For many of the countries, that was their strategic development plans or frameworks. In Vanuatu, their national health sector strategy also mentioned older people specifically. So what were some of the shortfalls in the policy environment that we could identify? Firstly, the absence of even the word older adults. So the policies themselves rarely address specific needs of older people and often grouped them more broadly with vulnerable populations. There's very limited attention in policy to integrate health with social care services, which would obviously lead to a fragmented response to older people's needs. Limited mention or strategy around workforce training, particularly around specialisation in geriatrics or long-term care, as well as that limited linkage between national policies. So non-communicable diseases is separate to disability, is separate to social protection. We saw that the monitoring frameworks attached to policies or strategy really lacked ageing specific indicators, which would make it very difficult for countries to really track how they're progressing in support of population ageing. And there are also no policy commitments at this point in time around understanding what the implications of population ageing could be, in addition to what technological and social innovation might be put in place to support older adults and their caregivers. There were, however, strengths, and I do want to focus on these. So across all of the countries, there's still a range of national policy documents that do indirectly recognise or address the strategic objectives of that regional action plan on healthy ageing. In Fiji, although their national policy of ageing lapsed in 2016, it was really a prime example how a policy could align health systems to older adult needs. And it also recognised the gender dimensions, which was quite progressive back at the time of when it was produced. That policy also established what's called the National Council of Older Persons in Fiji, which is a multi-sectoral body that provides ongoing cross-government coordination on ageing. Our policy review found community health workers and primary healthcare providers played a really important role in service delivery, and they do offer an entry point for integrating ageing services. And we also found that national health plans in particular demonstrated a commitment to health system strengthening and health system development, which can provide leverage to incorporate ageing specific services. So all in all, the existing national policy frameworks in each of the 4 countries do provide a strong leverage point from which to build national responses to healthy ageing. So the third component I'm touching on here is evaluating the community and provider perspectives on ageing and the ability to health services to meet the needs of an ageing population both now and into the future. We approached this through qualitative work, so we conducted focus group discussions with older adults and caregivers in 3 of the 4 countries, as well as with government and non-government interest holders. You'll see there the breakdown of the discussions that were had over the course of the research. I just want to touch on some of the overarching themes that came out of that qualitative work. So from the community, so older persons and caregivers, we saw a prevalent sense of respect for and recognition of the importance of older people within society. At the same time, however, we did identify that ageism and disrespect was experienced by older people in some settings, and this came out in Fiji and Tonga in particular. We found that older people reported that their declining health and perceived loss of capability really inhibited their participation, and that they were very keen to remain active and to retain their agency and participation as they got older. The work highlighted again that primary healthcare services are the first point of call for older adults. However, still the cost of transport and medicines remain a barrier to accessing care. There's long wait times at hospital clinics, primary care clinics, and inadequate resources, particularly at facility-based care for the needs of older adults. We found also that healthcare worker availability, as well as their skills, including communication skills, were perceived as inadequate to meet the needs of older adults. And just generally, there were a lack of services that were targeted specifically to older people. Basic safe water and sanitation still remained lacking in areas of Federated States of Micronesia where we spoke to communities. And we also found a pretty prevalent sentiment that the government social security benefits that were available, when accessible, they were still inadequate really to cover even costs of basic living costs. Importantly, and this is reinforced throughout the whole program of work here, family are the primary caregivers of older adults in Pacific Island countries. They identified a need for more support, more training and more resources, particularly for those informal caregivers to be able to provide best care for their family member. We also found that caring responsibilities negatively impact the mental health of carers and also their ability to earn an income due to their requirement of really, staying in the home environment to care for relatives. Through the discussions with government decision makers and health workers, as well as non-government agencies providing programs for older adults, these stakeholders identified inadequate health infrastructure to optimise the care of older adults, particularly the physical environment, so clinics, roads, really not age or disability friendly. There's an inadequate number of appropriately trained healthcare workers and also a lack of specifically tailored programs and services for older adults. Again, these groups of people identified that need to provide training and support for informal caregivers. They thought there was a need to strengthen public awareness of healthy ageing, as well as the services that are currently available to support older adults and their family. And they also felt that there was still an untapped potential to harness both existing data as well as gather new evidence to inform context-appropriate programs and services for older adults and their caregivers. Based on this information and through our work with the policymakers in each of those 4 countries, we put together a set of recommended actions for Pacific Island countries to consider when it comes to population ageing. Being from a research environment myself, we also couldn't help but identify some additional evidence priorities for people to consider as we move forward. So we've got 8 recommendations, which I'll talk through briefly. The first being a need to coordinate national and regional advocacy efforts to raise the priority of ageing issues, both for government and non-government interest holders. The second recommendation, very important, empowering family and informal caregivers as the key providers of long-term care for older adults. There's a need there, recommendation 3, to strengthen infrastructure and resources for health and social care. And then recommendation 4 also goes back to that burden of chronic disease. Really strengthening community-based models of primary health care for older adults is critical, with a focus on preventing and managing some of those non-communicable diseases that are the most prevailing causes of death and disability. It needs recommendation 5 to prioritise financing and funding of healthy ageing initiatives, including supporting caregivers. Recommendation 6, strengthening community-centred initiatives, and these could be designed to maintain the participation and the agency of older adults within the community. Recommendation 7 is around strengthening health information systems, really to provide disaggregated data to support the design of equitable health programs. At the moment, many of the health services do not have health information systems that can quickly produce disaggregated data for us to be able to identify those with greatest needs and what those needs might be. And then finally, recommendation 8 is to consider a standardised approach to the collection of data related to healthy ageing, and really ensuring adoption of a regionally harmonised instrument for the measurement of disability, which is something that's currently lacking. And in terms of additional evidence, I might leave these up here without talking through them directly, but really research priorities that will help with the design of services and care models, and also inform decision-making around healthy ageing policy, as well as policy implementation strategies. So just to finish off, just some additional acknowledgements. A small team at the George Institute and UNSW Sydney who really supported some of the data collation and analyses, but most importantly, just wanted to thank the older adults, caregivers, health workers, government officials and non-government partners who really generously gave their time to share their thoughts and experience for this work. Thank you.
Thank you very much, Anna. Obviously, a lot of work has gone into this, and we can see that you've done a tremendous work on both capturing the information currently there, as well as then looking into trying to identify policy environment, as well as the viewpoints of the end users, and come up with some quite robust recommendations. I'm before I'm going to take the moderator's prerogative in here, because before I go to the panelists to ask them specific questions from their viewpoint, I'm going to ask you a question which came up in the chat, which is about your thoughts on nursing homes. Now, we know that in the Pacific Islands, in many parts of the developing world as well, the idea of formalized care as opposed to family care is not as well established. But the question is around, are these cost-effective or cost-efficient studies to show whether or not it makes sense to develop nursing home models? Do you know anything about that? Over.
Thanks, Nima. Look, I don't know anything about cost efficiency modelling in the Pacific region, and I don't know that it's something that has been done. I think the bigger question is more around the acceptability and cultural appropriateness of these sorts of facility-based models of care. And we definitely found within the qualitative work, a very strong sentiment that, older adults, elders should be cared for by family within the home, within their home village, within their home community. So it was very largely a sentiment of, how can families be better supported, knowing that is, the culturally preferred way to manage the care of older adults. So yeah, I can't really respond in terms of the economic argument around nursing homes.
But I think you've spot on that, the cultural issue is just as important, if not more important, that if it doesn't matter how efficient it is, if the people don't want it and don't accept it, it becomes an issue. Okay, let's move to our panelists. As I said, we've got 3 eminent panelists in here. I'm going to open with a question to all of you, and then I'm going to ask if Mikiko could start, followed by Ili, and then to Ling. And that's around, how do you see, from your organization viewpoint, how are you engaged? How do you see that engagement with regards to addressing the aging in the Pacific? How can we actually use these recommendations? How can we contribute to moving the policy arena forward when it comes to establishing a more aging-friendly, I guess, environment on the health system and in the wider society? So let me start with Mikiko. Looking forward to hearing your voice.
Thank you so much, Nima, and good morning, everyone. My name is Mikiko, and I'm the technical lead for the Healthy Aging Program at the Regional Office for the Western Pacific. So I have one slide. It's just sharing that for our concept of the healthy aging at the regional level. So across the Western Pacific, as Anna already shared, the Regional Action Plan on Healthy Aging is our anchor. So it turns longevity into the opportunity for older people's independence, for families and the communities, and therefore smarter, more resilient systems. So we have like 5 objectives. So which already, like Anna shared, I may not go into detail, but it's first is a transform societies. Second is a transform health systems. So community-based integrated care, as well as the innovations. And then lastly is monitoring the research. So with these 5 objectives, we work together to build an ecosystem where that the people of all ages can live, work, and contribute, supported by both health and non-health sectors. So with the personalized health and social services in the community, enabled by the appropriate technology and then continuous improvement. So this is so we see that as a healthy aging as a pathfinder for the health and the social, future health and social systems. So moving on to that as the recommendations from the APO policy brief. So now I'd like to share some thoughts on for the opportunities at the regional level. So first is coordinated advocacy. We work with the government and partners to keep healthy aging high on the agenda. Regionally, via, for example, like a joint advocacy between the UN SCAP and then WHO OPET with the regional director and then deputy executive secretary at the UN SCAP. So that was published on the 1st of October for the international older persons at the World Economic Forum website. So, and then this now is retracted nationally by aligning messages across sectors. So it's the core message is that the people are living longer. There is a 65% population 65 and over in Asia Pacific will nearly double in 2050. Older people are silver dividend with skills, care, and resilience to contribute. So we call governments, employers, and the communities should act now to support older people. So building on this op-ed and the other platforms, we are trying to amplify these messages at the country level. So member states take early and practical action on healthy aging before population reach to aged society. Second one is aligning with the objective 3 of the regional action plan, strengthen the community-based integrated care system. So WHO supports member states to deliver community-based integrated care for older adults, a person-centered approach that links prevention, primary health care, social care, and then community supports, coordinating the clinics, home, and the community-based services and caregivers, so older adults can age in place with a maintained functional ability and a seamless care across settings. So a practical entry is an integrated care for older people, which is like ICO approach. So screen for declining in the industry capacity, make a simple care plan, and the established clearly for pathways across the health services, which is like existing building, introducing into the existing health and social services systems. So which also includes the long-term care. So this aims for healthy older adults to maintain their industry capacity by preventing an early detection of the decline in the industry capacity so that they will stay in the community, even though they will stay in the employment, so that is that they contribute to the society. The third one is about creating the age-friendly environment. Work beyond health to shape places that protect function, also the participation. So for example, healthy, safe walkability and the crossings, or shade and then benches, accessible transport, building, community engagement for the social participation, and heat and cooling alerts with the mega trend of the climate change. So these are small, but however, the affordable and changes that all of society benefit. So these are the regional the approach, and then that would be some of them could be applicable to the Pacific Island countries. So when it comes to the Pacific Island countries, many countries are still demographically young, yet early action is essential because of this reorienting social and health systems takes time. So we have an example with the Palau. We supported Palau to develop the national policy on care for the aging. So this was used for the backcasting methodology from the vision of age-friendly society run can focus group to set 6 pillars with a different culture, environment, prevention, long-term care, social services, and health systems. And they built a cross-ministry committee to turn into a national policy despite the pandemic delays. So what matters is that the start early, a model for the young islands to prepare system before rapid aging hits. Second is a whole of government, simple, replicable coordination across various ministries. Also culturally rooted and practical, community-driven design. That was an approach, a participatory approach was taken during the process of the development. So that design is that it translates into the phased services with the limited resources, as well as it's accepted by the societies, and also importantly, older persons. So while we understand that it's when we say it's a Pacific Island, this is like a not one fit all. So, and then we understand that it's in a context vary among the countries. But however, the Palau offers a strong model that offer that other Pacific Island countries can adapt as the population age. I stop here. Thank you so much.
Thank you, Mikiko. So in here, what we're hearing is that the overall policy-related issue, so policy environment, but also some, the importance of looking at the physical environment and the interactions with the health system and planning early, because quite often the countries a lot of older countries now, they were rich before they became old. And what we're looking at the environment and the scenario is that, we are looking at countries who may well become old before they become rich. So the approach must be much more planned in that sense. I'm going to move, thank you, Mikiko. I'm going to move now to ask our second panelist, which is Ilisapeci, to talk about, from your viewpoint, from the SPC viewpoint, and from the disease viewpoint almost. Because what we heard is that from the epidemiological pressure, we managed a demographical issue. The epidemiological pressure is going to be the non-communicable diseases which are going to bring the burden. And that is, as Anna showed, that there is leverage to be used from different angles to actually make the health system and make the society more responsive to the aging process, to the aging population. So, Anna, what are your thoughts on this particular issue, looking from that angle? Over to you. No, sorry, Anna, I mean Ilisapeci.
Thank you, Nima. I was so the question is around from the disease perspective. I think in the position that I sit in today, most of the work we do is building policies and legislative environment to support the management in the health systems. We do have within the Public Health Division our clinical services net program that does support a lot of that group, a lot of the work around health systems. So if I just had to step back and see how exactly SPC could leverage on the things that we currently work on, I might just quickly just mention that in the SPC organization as a whole, a lot of the work that we do is really guided by the strategic oversight of 2022 to 2031. And aging is not treated as a standalone theme, but it's actually integrated through all the work that we do, not limited to health, but also looking into the social aspect of it, the social development, the inclusion agendas. So when it comes to health, what would often happen is we would try and, the programs would collaborate with other partners in this area to strengthen the services around clinical services provision to the countries. Having mentioned in the introduction that we look after 21 Pacific Island countries and territories, we would capitalize on existing clinical services network that we support. So in mentioning that, a lot of the clinical services network have different cadres of clinicians that we work with. And this webinar has actually, the preparation towards this webinar has actually allowed us to reflect a little on the work that PH, the Public Health Division, has been doing up until this point. We have policies and legislation that we support through countries to try and support and strengthen their systems. This policy has provided us an opportunity to now reflect back on what else could we potentially strengthen to address the clinical management part of the diseases. I'm going to stop there because I think I will just provide from the policy aspect, but the clinical management part will come through our clinical services program, using what currently exists through the Pacific and utilizing the networks that exist and trying to raise awareness around considering aging, healthy aging into their various policies and strategies. Thank you, Nima.
Thank you. Thank you. Well, I'm glad to know that as being involved in the webinar, we are actually reviewing the policy and trying to see how we can actually leverage. Some part of this conversation is about how do we leverage findings in moving the agenda forward. I'm going to, there's a whole bunch of questions coming up, but let me ask the last question from Ling, which is about the same thing. So we've talked about, the WHO, the SPC. Let's look at from the viewpoint of a university, which is involved in actually producing the health workforce, which are going to be feed into this at various levels. What are your views about how can a country become more resilient and adaptive towards a more agent-friendly health system? Over.
Thank you, Nima. That's a very important question. So, as a training institution, as you correctly stated, we're basically training health professionals from doctors, nurses to allied health. And so obviously we are contributing to the workforce of the countries, Fiji and the region. And so as I see it, when it comes to aging specific programs, unfortunately for our College of Medicine, Nursing and Health Sciences, we don't have a specific aging program, but it is offered at another college of the university. So it's a certificate in aging and community support. So it is still part of the university. So as far as our college is concerned, I did mention there's no specific program, but because we are dealing with health, it's just part of our everyday work that we deal with all the age groups, from the pregnant, the newborn, all the way to the elderly. So, and as a training institution, we obviously would respond to the needs of the community when the need comes forth that we need to develop an aging specific program, then we will have to comply and see how we can work with that. Thank you.
Thank you. Let me ask a follow-up question. You mentioned that in your university, there isn't, in your college, there isn't as much focus, well, there is specific focus on aging. But are you potentially looking at changing the curriculum to bring some of those things out as we move forward? Because, setting up a curriculum, a teaching curriculum, is a 5-year, 7-year program before it's fully implemented and everything. But is that on the horizon? Let me put it that way.
Thank you. That's another very important question. As it is now, most of the Pacific Island countries, we know what the population is like, where most of the we are a younger population. So when it comes to health conditions, diseases and all, even the hospitals are mainly filled with younger patients. So yes, obviously that's something that I'm not saying that we shouldn't consider, but as it is now, we're all the NCDs and infectious diseases, they're all mainly in the younger population. So yeah, I think if the need is there, then we will have to go where the need is. And I think Anna and the studies are showing that the end users, their perspectives, and we obviously will have to work with our stakeholders. So that's the health services, the ministries of health as well. In this regard, on how we can change. Probably some of it has to do with customer service, and in terms of program, like I said, it's integrated. It is part of the training, but we're just not specifically saying that, okay, this curriculum is only for the aging population and the rest, it's just incorporated. It's all just part of it. Yeah, thank you.
Thank you. Okay, I have a bunch of questions. I've got another question, but I think let's go to some of the questions that's been brought up by the listeners. Let's start with the easy one. There's a lot around community care and care in the family versus institutional care. which we've touched on. But one thing which came up is that in some other countries, it's the religious institutions in the community which become a focal point when it comes to providing care. In your own, either through the study or in your own experience, do we notice that is there an established role for religious institutions in the Pacific Island countries, which are in service delivery, in service integration? And I don't just mean health, I mean health and social care. Which they have a place, or do they have a role? Are they playing that role? Anna, do you want to start with, and then I'll see if anybody else wants to answer. Or
I might ask Dr. Ili. I think she's probably the best person to answer from a
Ili.
Pacific perspective.
Yeah, thank you, Neem. I think that I think in reading through the papers and just reading the importance that the role that the community plays, civil societies and NGOs, I think one thing that COVID has taught us is when there is a crisis, a lot of the health service workers are centralized around the main service delivery points. And this is where civil societies, including faith-based organizations, play a huge role, noting that in a lot of these organizations, they have retired health workers who are already part of it. They're very familiar with all the services that could be provided. So in some countries in the Pacific, you already have the churches involved. So if I could just name a few, one is the Solomon Islands. They've got the Seventh-day Adventists who are very much part of screening within the community. More recently, there was a Pacific Council of Churches that was a conference up in American Samoa, where they are now recognizing the role they play in the community outreach for NCD. So that is an area that NCD as partners, we're recognizing the role that civil society, faith-based organization, and even the youths play in addressing those gaps, some of the gaps that the ministries of health are not able to reach. I hope that answers your question.
It does, yes, thank you. So there is a role. I'm just smiling to myself that it's actually the retired, so the elderly who are actually going to providing the care in the churches. So what we are seeing is that the elderly are providing services. Another thing which came up is from one of the APO's long-term friends and collaborators. It's around this paradox of culturally, what we are saying is that it's the families who are supposed to look after the elderly. And we see this, and there are a whole bunch of questions about do we actually have any numbers, etc. But at the same time, often we see an out-migration of the working population from these very communities going. Any thoughts? I guess it's a policy question more than anything else. Any thoughts about how can we actually manage this paradox, this issue on that? Anna.
Thanks, Nima. And yeah, I noted those questions in the Q&A and just responded to Maxine actually. But
oh, you did, okay.
But yes, it's an issue, and it's interesting. It was brought up particularly in the discussions with Tongan interest holders and decision makers, and the concept, that facility-based care just isn't really culturally acceptable, prevailed, yet the option of perhaps what we might call hybrid models. So, day respite, for example, where older people may be able to gather, providing social interaction, providing a platform for health screening, for health education, providing an opportunity for intergenerational interaction as well. Those sort of models are things that I think if we're going to slowly move towards more formalized long-term care for older adults, it's going to be those models that are most likely to actually be acceptable within at least the 4 country settings where this work was done. And I think this links back as well to the question about religious institutions to women's groups. I mean, they have such a strong role within communities, a strong trust with their community. And I think when looking at the approach to models of care within the future, those links between government and non-government or informal are going to be really important to be able to strengthen and also address through policy. And I note the quick Q&A that it's not it's not an easy solution when you're trying to, address informal and formal and government and non-government through policy options. But it's really something that I would think, at least from the findings of the work that we've done, is going to be necessary to address particularly that paradox of people wanting to age with family, but family structures no longer being, what they may have been a decade or so ago.
Thank you. And that certainly opens a whole new area of issues, I guess, because as part of developing, if you like, a day center, respite care center, the issues of transportation and such things comes into mind. So how do we actually move the elderly to these centers for a day or so, or for the daytime? But that's I think it's an approach which also then builds up into moving forward. We cannot be on a binary of saying that it's either family or nothing, or it's either institutions or nothing, and there has to be multiple approaches in integrating the care for the particular population. I am looking at if there are any other additional questions from the listeners. There are some questions around training and the need for the community care level, which is understandable. I'm going to ask if there's anything specifically that people want to type and ask, because I think we've answered most of these questions already. If not, 2 minutes each or 1 minute each from the panelists, if they have any additional, and from Anna, if they got any additional points to bring out that they feel is important that they haven't had a chance. And otherwise we can wrap the webinar. If there's any additional points that people want to bring, go ahead, Anna. I'll pick on you first.
Thanks, Nima. Look, I'd just like to touch on, obviously I think we focus on the health system in this work, but this is really a multi-sectoral issue. We know there's aspects of age-friendly environments, it's around infrastructure, looking at the environment itself and climate change implications as well. And I noted the question in the Q&A around that. Obviously, there's health systems, there's social protection, there's gender-based issues as well. So, I do think taking a multi-sectoral approach is really critical. And when we're looking at aging policy, whether it's standalone or it's bringing together the strength of existing policies with a focus on emphasizing how those policies could address the needs of older adults and caregivers. One thing that is needed is some sort of a body, some sort of a strategy to approach that in a multi-sectoral way. And again, this one's not an easy question or easy solution, and we still, I don't think, have seen it across a range of other areas, sort of, effective multi-sectoral responses. But I do feel definitely that in this area of population aging, it's going to be critical to work towards something that's effective to enable people to age healthily, whether it be older people now or generations who are currently 20 and sort of moving through that period where prevention is key, and then getting to a stage of life where they can age and enjoy quality of life.
Thank you. Let me take that theme and ask our two regional partners here, the two regional representatives. So much of our work that we do in the health sector now is around multi-sectoral approaches. The SDGs are fundamentally highlighting the need for multi-sectoral approach. Can I just ask you, how do you see the other SPC, or if you like, the WHO, how are we managing this issue of actually moving the agenda away from the health sector, from the health that traditional? Because a lot of these things about working with other agencies or working with other ministries or advocating for health or providing the support for the health sector to work better with other agencies. How do you see that working? How do you see that happening? And do we have a role, and what is our role? Let me make it as broad as possible so we don't point fingers. Ili, do you want to go first and then Miki?
I was looking to our WHO. So maybe I'll just speak from the experience that we've been having around multisectoral engagement to address NCD as NCD programs. One of the requirements of NCD programs in the Pacific is to have a multi-sector committee where you have all sectors sitting at the table. This is right across sectors, social, finance, agriculture, the whole lot of them sit around the table. And then while you may have a multi-sector committee there, one of the things that we've quickly learned is that the engagement of the multi-sector is only as good as the amount of information or advocacy that has been shared with the multi-sectoral members. And so in reflecting back at how this would progress forward from the work that we do, this is an area that we could potentially take through the multi-sectoral to raise awareness around trying to see if we can ensure that there is some intentional focus is put around aging. In the absence of understanding where their role lies, this is where the multi-sector engagement doesn't really successfully work. So that's just from the experience that we're having in the Pacific, that we talk about multi-sectoralism, but when you go in countries, the ones that are successful is where the partners do understand the roles they play towards, reducing premature mortality. And if we had to add healthy aging to that, it comes back to advocacy. So maybe I'll stop there and hand over to Mikiko.
Thank you, Ili. I think that's a very important point and we've all experienced that in all aspects, is that, unless you prepare the audience, they're going to sit down and say, okay, well, why are we here supporting you, kind of your agenda, kind of our issue. Mikiko, over to you.
Yes, thanks, Nima, for the question. Yes, we always like saying that it's a multi-sectoral coordination, collaboration. This is like really difficult, but it's not, from our experience it's not like specifically for the Pacific Island countries, but it's not as a region. We see that it's some of the like a mechanism, for example, like a national coordination mechanism of the healthy aging, that is kind of like a working well. For example, like the Philippines, National Commission for Senior Citizens, which is like directly under the president office, above the whole different department, not only like health, but the others. So that creates the policy of the plan of action for the senior citizens, which is like one of the examples. Also, there's in New Zealand, Japan. So this kind of like a national coordination mechanism when they have in the government, that will create the settings that not only health, but it's also other sector will work together. So kind of like a systematic approach that we can see, we are seeing. Another point is that these age-friendly environment. This is kind of like one of the entry point, because it's not when the subnational level is trying to create the age-friendly practices in their communities or cities. They ultimately, the focus would be like also could be one of the easiest entry point, could be like a transportation or some kind of like a walkability improvement, these things. That requires always like a health needs to reach out to the other sectors. And then of course it's not, I don't want to mention, I'm not saying that it's health is just like limited, but it's not working together. Health has a role to do. And there are things that the health sector should do, but also that we have to work by working with the other sectors, that especially for the age-friendly environment and also the long-term care for the working with the social sector, that requires and then that is a kind of like entry point that we could consider. So at the regional level, or it's as a UN agencies, I think so working with the other UN agencies, also the one of the experience that we are currently have. I mentioned that it's working with the UNSGAP, working with the ASEAN, which is also including a social sector. These are the kind of we are exploring the way that we work with the other sectors and involving them, doing the multi-sectoral coordination. So how this can be applied to the Pacific Island countries, that we also need to think about, but just to share our experiences. Thank you.
Thank you very much. As you were talking, I was thinking that, and this is completely off the cuff, UNAIDS and the Global Fund have created multi-sectoral agencies for managing HIV at national level. So there are examples of other diseases where we actually have managed to create involving NGO sector, involving the civil society in actually managing something, and just putting it out there as a potential model to look at to see whether or not something like that could be applied to a much bigger demographical issue. Malik, I'm going to ask you, if you don't mind, if you have any final thoughts and comments. We're coming towards the end of the session, but do you have any final thoughts or comments? There is a questions about, training for the community and the community and caregivers moving forward as an area where there is, as the demand rises, there will be a need, and we see that happening in other countries where the demand is much more for those services. But if you have any final thoughts, please.
Yeah, thank you, Nima. I think for any training, there's always the risk of brain drain, and so I am aware that in Fiji, in particular, there were some caregiving training centers, maybe one or two, and I think they were getting a lot of people trained, but probably the main push or purpose for that was to go overseas and be a caregiver. And some of them have gone and come back because of some issues. But basically, what I'm trying to say is that there is a need, and unemployment is also a big issue. And I think if the need is there, and probably if the government recognizes that need and support caregiving training for the community in some way, maybe that will ensure that people stay in their countries after their training and provide the needed service to their community. Like I said, brain drain will always be there, but recognizing the need and ensuring the training happens, and people have the security of a job because they've done some training, that would be a good way to help find solutions to this issue. Yeah. Thank you.
Thank you. And thank you for reminding us of that. No country is alone in here. There is a lot of globalization going on as part of this wider issue. We're talking about integrating, we're talking about health sector within the country, but we just have to be aware that there are other pressures and influences that people use to make their decision on work, on life, on caregiving, etc. On that note, I want to ask anything that any of our panelists or speaker want to say, and if not, I want to thank all of you for giving us your time, giving us your thoughts, your expertise. And I want to thank all of our participants and listeners and viewers for bringing these questions up, which challenged all of us in trying to provide the robust answers. And I look forward to working with all of you in the future. And thank you again.